This essay example, as well as thousands of others, is available in text format on our website for free and without registration. Simply Google Ivy Panda Free Essays.
Abstract. Fast food poses a profound negative impact on health due to the dynamic means of preparation and the reliance on carbohydrates. Apart from the reuse of oils, a significant percentage of junk lacks a balanced diet for consumers. The phenomenon results in the ideological perspectives of increased obesity and the emergence of lifestyle diseases. This research utilizes analytical methodologies in comparing previous records between 2019 and 2021 to determine the effect of fast foods on individuals during the COVID-19 pandemic. Further, the researcher integrates certain values encompassing gender, age, ethnicity, and income range. Although the team experienced limitations concerning subjective responses posing higher bias scores, they alleviated the incumbent by using descriptive and inferential statistics. During modeling, the significant variant is logical regression against cross-validation. Introduction. The popularity and consumption rate of fast food restaurants is one of the trending issues in cities and towns. The ease engulfs the concept of low costs, desired taste, hasty preparation, and convenient locations. Primarily, the cafeteria emergence offers an ultimate solution regarding feeding habits. However, it is a phenomenon that also increases the rate of health risks among consumers. The consistent use of the suet at high temperatures leads to the breaking down of chemical compounds into significantly toxic elements for the human body. Although fast food offers an ultimate convenient solution to dieting, it is a multidimensional phenomenon that increases consumers' health risks. Factors that influence the effect of fast food. One of the issues posed in fast food restaurants is the primary use of the deep frying cooking technique. A significant percentage of the meal preparation approaches optimize frizzling as the fastest and most convenient catering service. The chef uses less oil to sear the food in large amounts to boost the profit margin. In some cases, the cook recycles the oil cause of economic sustenance. However, the utilization determines the rate of health risk to the consumers due to the breaking down of the chemical compounds. Project Overview. Project Objectives. There is a proficient dataset corresponding to the research question, Effect of Fast Food on Human Health. The dataset includes food price comparisons, health metrics, and obesity statistics. The source material relates to the research question encompassing the dynamic effect of junk eating on individuals. In this case, the article provides an in-depth analysis of the variation across sexuality and ethnic groups concerning feeding habits and the attributable causes of the lifestyle. The organization in charge of the contextual baseline for the publication is the National Center for Health Statistics, NCHS, which manages data collection concerning the well-being index among Americans. NCHS is a component of the Center for Disease Control and Prevention that focuses on assessing the impact of lifestyle illnesses on nationalities. It is a practice that profoundly provides insights into the significant medical issues and the causative agents across the population. Fryar et al.'s 2020 report is a compilation of the comparative approach concerning the 2015 to 2018 records on the impact of fast food on people along the gradient of age, gender, and ethnic diversity. The sample size will be determined by the population metrics of the data sources. The research fosters the overview of critical variables relevant to this study involving the eminence of fatty foods and the intermittent consequence of obesity. Analytic questions. Is it cheaper to eat fast food than home-cooked meals? Does fast food damage your mental health as well as your physical health? What is fast food's contribution to obesity in the United States? Specific details. This study will use information from 2019 to 2021 as the primary data source for analysis concerning the impact of fast food on the human body. The analysis focuses on the trickle-down effect on the lifestyle among the nationalities. Therefore, the survey will include the United States due to the proficient impact of the practice among the residents. 3 rows and instances will be used in order to include 3 key metrics. The data features involve evaluating the relationship between feeding habits from convenient restaurants and the emergence of the COVID-19 pandemic. The advent of coronavirus led to the lockdown of American and other global nations' economies. Data wrangling. The number of rows will be 3 for a better comprehension of the discussion subject. The critical data features incorporated in the final project enshrine a comparison of the gender, age, ethnicity, and income differential range relative to the tendencies to consume products from a cafeteria. The marginalization under the mainframe of such inequities as education, occupation, and income causes the interdependence between convenient cafeteria outlets and poor households. The team intends to use logical regression to explore the findings and justify the objectives. It is an entity that engulfs the intersectionality of statistical overview against the logistics from the realm. During the data collection process, the significant errors involve the subjective interpretation of respondents' attitudes toward dieting and risk bias. However, the team will utilize descriptive and inferential statistics to complete the phase. The transformation used by the team involved the utilization of several datasets within a closed time period to establish the key variable of objectivity during the data analysis. The assessment approach renders the comprehension concerning the goals of the study on the impact of fast food on healthy living among people. Different aspects contribute to the dynamic effect of the framework among the personalities, hence the importance of understanding the impact on mental health, obesity, and cost efficiency. Did you like this fast food effects on human health sample? To get more works like this one, make sure to check out the free database of academic paper examples at ivpanda.com. You will find thousands of samples for all your study needs, without even having to register.